Hi everybody, my name is Birgitta and I will be discussing opioid misuse in college students. To start off with, opioid misuse is defined as using medication in ways other than intended, using other people's prescribed medication, or using medication to get high rather than for pain relief. Some specific types of opioids are morphine, oxycodone, heroin, codeine, hydrocodone, or hydromorphone. Commonly used opioids in college students is hydrocodone or Vicodin, oxycodone, also known as Oxycontin, Percocet, Oxy or Percs, and lastly codeine, which is also known as lean, and codeine is the opioid that's found in cough syrup. Mortality rates in the United States is an important statistical analysis to look at to understand the true severity of the opioid epidemic we are currently experiencing. Opioid overdose kills 41 people each year in the United States. In 2018, it was reported that 15 deaths per 100,000 people were caused by an opioid overdose, and specifically over 3,000 people ages 0 to 24 died due to an opioid overdose. Prevalence rates in the United States for people aged 18 to 25 is also important to understand who is currently using opioids in the college age range. So 5.5% of individuals in the college-aged range misused pain relievers out of prescription in the past year, and 1.4% misused pain relievers in the past month. Opioids have many different physiological effects in the human body. Some neurological effects may be drowsiness, euphoria, stress relief, mental confusion, or depressed respiration. So, a high dose of opioid may cause an individual to stop breathing. Some gastrointestinal effects may be nausea or constipation, and other effects might be the inability to urinate, low blood pressure, constricted pupils, or increased risk of infectious disease due to needle sharing. The risk of opioid use leads to addiction. So we reach addiction by starting out with abuse, which then leads to tolerance, which then leads to dependence, and then leads to addiction. Abuse occurs when the user is using the drugs outside of the prescription, so the abuser is using the drugs to get high rather than for pain relief. Tolerance becomes evident after 2 to 3 weeks of frequent use, and tolerance can be reached quicker if the user is using opioids at higher doses. Dependence can be physical or compulsive, making stopping the drug much harder. Dependence is important to understand because it can cause severe withdrawal symptoms, which may be exaggerating pain response, agitation, anxiety, stomach cramps, vomiting, joint and muscle aches, and so on. How does opioid misuse affect college students? Opioids can affect college students in various ways, ranging from physiological effects to social effects. So some social effects that college students may experience are poor academic performance, sleeping for long periods of time, moodiness or depression, anxiety attacks, or cutting class. Some severe consequences of opioid use in college students can be suicide and overdose. A study analyzing almost 900 college students who use opioids reported 38.8% had suicidal ideations, 11.6% reported making a plan, 7.6% reported attempting suicide at least once in the last 12 months. As for overdose, young adults ages 13 to 25, there is a mortality rate of 12.6 deaths per 100,000 people in 2017 due to opioid overdose, and drug-related deaths due to opioids have increased over 200% since 1990. Treatments available for opioid addiction include medication such as methadone or naltrexone, and some non-drug treatments are rehab centers, support groups, and behavioral interventions.